Hello, my name is Aramandla Ramesh. I am an associate professor with the Department of Biochemistry, Cancer Biology, Neuroscience, and Pharmacology. I am also with the National Center for Medical Education Development and Research at Meharry Medical College. This center is headed by Dr. Paul Juarez and Dr. Patricia Matthews-Juarez. The aim of the center is to address the needs of people from vulnerable populations, especially gender, sexual minorities, people experiencing homelessness, and also the migrant farm workers. The main charge of the center is to introduce educational interventions and to track how the findings in the medical education curriculum and changes could be translated into primary care training and practice guidelines. The center is funded by HRSA, and one of the topics that we are interested is assessment of educational interventions for delivering healthcare through telehealth. And more so than ever, the recent COVID-19 pandemic has highlighted the way we use telehealth in providing primary care to patients. There are several issues that you may have noticed. One is difficulties in maintaining social distance, and the other one is concerns associated with the spread of disease. These two factors have kept away patients seeking medical care even in times of crisis, and therefore there is a greater need to assess how medical students and residents are being taught to use telehealth to manage healthcare, especially in the times of acute and chronic health conditions. So keeping that in mind, we have conducted a systematic review of the literature using PRISMA guidelines to identify original studies that assess the current state of training healthcare personnel in telehealth. So as part of our systematic review, we conducted a literature review of 7 databases, which includes Google Scholar, PubMed, MedEdPortal, Web of Science, ERIC, PsycInfo, and SinaHealth. And we have screened 96 articles, which were subjected to layers of screening process that includes removal of duplicates, screening articles that were published only in English, and screening studies that were done in the continental US and other places like Hawaii, Puerto Rico, etc. And then to check those for strictly any kind of educational interventions, and to see whether those articles have employed both qualitative and quantitative approaches. After rigorous screening, we only found out 6 articles that addressed how to teach healthcare providers using telehealth. And what we found out were, in regard to telehealth teaching, there were very few studies. Those studies targeted the comfort of care providers, the knowledge of care providers, and the proficiency and the skills and techniques for using a telehealth for the patient consultation. At the same time, there were no studies that focused on the attitudes and the confidence of students, residents, and also patients when they deal with the care providers through internet or through telephone. And unfortunately, none of the interventions focused on using telehealth among vulnerable populations, either gender, sexual minorities, people experiencing homelessness, migrant farm workers, or people who belong to socially vulnerable groups because of their socioeconomic status, lack of insurance, lack of transportation, and so on and so forth. So another shortcoming is there is a lack of intervention research and in using telehealth, and not many studies were done to check patients' comfort after consulting the care provider using a phone or internet, patient satisfaction, and also to gauge care delivery, how comfortable patients felt after telehealth consultation, and whether their expectations were met, or what else could they expect from the care providers. So one of our recommendations is to integrate telehealth into medical education curriculum, and also to conduct the training of students and residents, conduct refresher courses, and introduce more telehealth based training regimens into their clerkship years, and also for residents. Thank you.